patients across the Humber are benefiting from more joined-up healthcare. That's thanks to the rollout of a new initiative to share information between NHS providers. Healthcare professionals can now see up-to-date information about their patients, even if they've been treated somewhere else. This improves the safety and the quality of care for people accessing a number of services, including end-of-life care. Dr. Lucy Adcock is the Medical Director at Lindsay Lodge Hospice in Scunthorpe. She's welcomed the change.
I guess a lot of patients assume that all healthcare providers that are using electronic records are using the exact same record and the exact same system. But that isn't necessarily true. Here at the hospice we have patients that come to us, they're in their own home or in their nursing home, and they come to us for just one day a week. We use one electronic system, and it may be that their GP practice uses a different electronic system. And if something's happened in their care in the week in between the last time they were with us, so maybe they've seen a GP, had an examination, had a new medication prescribed, we're able to log in through our system, view the GP record, and actually be able to see the examination findings that the GP elicited, be able to see what their thoughts were, what they were thinking of, and then see what medications they've prescribed.
The change is also helping nurses based in the community deliver more joined-up care. Lucy Armand-Bell says her patients are already benefiting from the two systems becoming interoperable.
I'm a complex care matron in the community. That job involves supporting patients with multiple long-term conditions and helping them to self-manage their own conditions to hopefully in the long term prevent hospital admissions and mean that they get a better quality of life. Recently I had a 91-year-old lady referred to myself. When I went to go and visit her at her home, she was very, very confused about all the medication she was on. She had medications everywhere basically and didn't know which ones she should be taking and which ones she shouldn't. So the new way of working enabled me to look at her GP records, which allowed me to look at her current medication, and I could work through that with her and get rid of the things she didn't need and ensure she had everything that she did need and that she knew how to take it properly. So it's benefited her because she's now on the right treatment for her condition and she's managing it much better by herself.
If you need a GP appointment somewhere that's not your usual practice, your medical history can now be seen by the person treating you. Local GP, Dr. Hardeep Gandhi, hopes this will lead to further improvements to local record sharing.
This has been an amazing breakthrough, and we have been waiting for this to happen for years together, when at least the systems could talk to each other. This has happened now in the last few months. It is in practice, and I'm hoping it will progress and get better in future. I hope in future not only EMIS and SystmOne but all the other practices which are used across the country can talk to each other, and not only within primary care but also with secondary care and community, like in district nurses, in A&E in the hospital, as well as the wards, the clinicians in the wards. If everybody could see what has been happening with the patient records in the past, it will be a major breakthrough, and this is what we're hoping for the future.